Hi, it's Micah. Just got back from a doctor appointment. I already filmed this video once today, but my phone alarm went off to remind me to go to my doctor appointment, and that deleted the video. So, yay. Sorry. I had to give blood. Something weird is happening with my nipple. So I had to give blood because they have to see if it's a hormone thing. And the doctor, I'm talking to her about like my nipple discharge. Looks like milk, like forms like milk. It happened one day when I was getting out of the shower. I was doing skincare, looking in the mirror, and I was like, oh, I dropped something, cream or something on my nipple. I wipe it off, doing more skincare. Nothing that is like cream. And then it's back. And I was like, what the heck? So then I wipe it off and I squeeze and it's like coming out. Like I like see it forming on the little pores, and then at the center it becomes a drop. And crazy. So anyway, that was happening a month ago. And so then I was telling some people about this as like a joke because I thought, it's funny. So I was using it as like a anecdote of hilarity, because when I just constantly talk about my CSF leak, people are like, what a downer. So I was talking about my nipple leaking, and then a couple of people were alarmed and said you need to go to the doctor because like nipple discharge is something it's like one of the signs of breast cancer. I don't have any masses or anything. Doctor appointment went great. Nipples both look healthy. The breasts are healthy as well. I leaked on command in the office, and then took a swab of that, and then they also needed to take my blood. So I gave blood today. So for my CSF leak procedure on Monday, they're gonna hopefully use this arm because that one's gonna be sore. And the nipple leaking was interesting because it could be connected to the CSF leak like crazy. So she said that it could be hormones, like something wrong with them, monitor them. That's what the blood was for. And then she said like your pituitary gland. She said, I would be interested to see if this keeps happening after your CSF leak is fixed, because she said if you're having pressure on your brain, because CSF is leaking, and then my brain it's sinking, it's low, it's coming out of the bottom of the skull, and there's pressure on my cerebellum, and that's why I'm having the vision issues and the balance issues and all of those things, because it's just like the bottom and the whole back of the brain. There's pressure, but also if there's pressure, like the inside of the brain can have pressure because it's not supposed to be happening. So she said your pituitary gland could be making random like nipple discharge, random leaking. And I said, oh, that's crazy, because I had to go see a psychiatrist who couldn't diagnose me for like months. I went and saw her, and she could not find like a reason for me, personality wise and like anxiety wise, why I would have like these panic dumps. And we talked all about the pituitary gland. At least I thought it was that. And I said, is that the pituitary? I think I remember, it's been several years. And she said, yeah, that's the pituitary gland. So like my psychological issues also like from this, because I never ever had it before my brain injury. Even when I was anorexic, I was very calculated anorexic, no highs or lows of emotion, but like crying all the time, crying when I'm happy, crying when I'm grateful, things like that never ever happened before my brain injury. And then I've never leaked out my nipple before. Pretty crazy that like my pituitary pressure on the pituitary like gland could be causing my nipple to just randomly leak, which is like actually so great if that's the reason why, because so often I'm like questioning whether a symptom is like, because a lot of them are psychological, so like the double vision and things like that, it's so hard to see it, but like my nipple leaking, that's weird, and it's a physical form of something weird is happening in your body, whereas like most of my symptoms I have to report. But like she saw the nipple leaking today, she swabbed it, it's an objective like response instead of something that I'm telling the doctor happens. So, and the finger thing is also an objective. But anyway, okay. Anyway, I am having my targeted now CSF leak procedure, surgery, whatever you want to call it, targeted epidural blood patch done via injection into the spinal cord, the epidural space of the spinal cord. I'm having that done on Monday. So last time I left off, the myelogram did not show a leak. So scratch that. That was false. When my doctor and I didn't report it or videotape it because I thought, whatever, nothing's going to come of it. So when we got the report back from the myelogram, it is like something like 2,000 images almost. And the doctor looks at all of them, assesses, is this extradural contrast anywhere? He says no. We get a report back that says no. My doctor and I also went over like the imaging, and he like fast forwarded through them and reversed it and all of these things to try to check. Because the doctor said, you know, it's not their fault. They've got a lot to do and not a lot of time. Sometimes they miss things. So I just like to double check with my patients. So doctor and I, the day after the myelogram, we're looking on the computer and we see something funny in the neck area. So my doctor said, I'm going to send this to him. If he double checks it and says, no, that's not a leak or that's not extradural contrast, then he's just going to schedule you and you're going to go to him, the doctor that gave me the myelogram, for a non-targeted epidural blood patch where they take the blood out of your arm, inject it into your lumbar spine as much as you can physically stand, and then it like travels up and hopefully finds the leak. Up or down, whatever. So he took a second look at the images before scheduling me for the surgery, just to double check. And he actually thinks that there is a leak in my neck. So double checking is good. And I'm really glad that we found that. So then I had to wait to go to a doctor that like wants to go into the neck, because the lumbar spine doctor that did the myelogram in the lumbar spine, he likes to only go into your lumbar spinal cord. It's where he's comfortable. So we had to find a doctor that day in and day out does your spinal cord through the neck area and does a good job with that. So we found a doctor. He is an anesthesiologist, neurological specialist, something like that. He has a couple of different specialties, and he goes into people's necks all the time. So have an appointment with him, and I vet him. He makes sure that he looks at the images, he gets the images, and then he asks me questions to make sure that this could be a leak situation. And he thinks it is. So I'm vetting him, saying, how often do you go in the neck? Do you use a fluoroscopic like x-ray machine thing when you're doing it? Because that made my myelogram like so much more comfortable, because I knew that the doctor was looking right at my spine when he's putting a needle through me. And like, how often do you do this? And he said, I just did 2 on Monday. I do them on Mondays. I've gone into somebody's neck thousands of times. It is my specialty. It's like asking a pilot, how do you know you can fly a plane? This is like what I do. So great. Feel comfortable with him. He says that for the targeted epidural blood patch surgery that he does, they have started to phase out putting somebody under, because for the actual injection, the actual spinal needle going through your spine and entering the epidural space, you have to be awake for that. So basically he has been in the past putting people under just to take their blood out of their arm and calm them down before they go sit in the chair, but they have to wake them back up again before they actually start putting the spinal needle through your neck. Because at least if it's like the myelogram, I'm assuming you have to like hold your breath when he's getting close so that he doesn't like overshoot it, or you don't inhale and then move the needle. So you have to be awake. So anyway, I'm going to go on Monday and get a targeted epidural blood patch in my neck. The extradural contrast is being seen between C6 and C7. That sounds awesome, because the targeted blood patches are far more successful than the non-targeted blood patches, because you know where it is and you're putting the blood around there. It's still the same idea of just throw as much blood as you can into the space, hope that it clots up. And same issue for like post-surgery where you are laying horizontal, completely flat. Don't get up, don't move, don't lift your head. And now with me, don't turn your neck, don't nod, don't do anything. Except for now I have to keep my neck like, oh, so flat. For as long as you can stand it. This doctor, because I thought it was just going to be 48 hours. And then after 48 hours, I'm done. This doctor said, if you can shoot for a week, the longer you're there, the more successful it's going to be. So if I want the best outcome, I'm just going to have to lay there for as long as I can possibly stand it. So we've got a plastic mattress cover, puppy pads, plastic sheets to make sure there's nothing touching blankets or anything like that, or pillowcases. We've got adult diapers. I think I can insert like the little easy to read do's and don'ts for the epidural blood patch procedure that we're going to be following. And then also my doctor sent me a full packet of like prep, like pre-surgery, post-surgery, do's and don'ts. Oh, and then after, so 10 days after my surgery, I have a follow-up appointment with that doctor, the anesthesiologist that's going to be doing the blood patch, just to make sure that everything's good. Yeah. It's crazy that I'm leaking out of my nipple. Like, and it could be because of the pressure on my brain, because of the hypotension and the brain sinking out of the skull, you know, not by much, like millimeters. I'm at like a 5. So that it's not much, but like obviously it's doing enough to cause these crazy weird symptoms. So it is scary. Like the myelogram, I was so proud of myself for how still I sat there. Like I just was really proud of myself for for just going through it. I mean, it was scary. And then now I've got this upcoming, and because it's in my neck and it's a smaller space that we're working with, I'm getting all of that anxiety all over again. And I'm really, really grateful that I had the experience of going through the myelogram, because if I didn't, I think I would ask to be put under before, because the doctor said that he will put people under if they are panicked, if they are like, I can't do this, don't make me go through this with the surgery. Like, so I think that actually might be useful, but I just experienced the myelogram like 3 months ago. And so I feel like I've done this. I lived, I sat really still. I had the capacity to do it, and I'm just going to have to do it again. I'm just going to have to lie really, really still while they go through my neck this time. I wonder how it's going to feel, because it's like, I know that you have stuff in your lumbar spine, like you have organs, but it's like, how, like when you think about your spine, I just feel like my throat, like my esophagus and stuff is like right there. I don't even know where 6, no, it's probably lower than that, C6 and C7. It's your last 2 in your cervical vertebrae. Anyway, it is scarier. And if I don't live through it, then you won't see another video. Okay, bye!